It's a pleasure to be here and talk to you today about some of the newer therapies in multiple sclerosis. Over the next few years, there's going to be multiple new medications coming out that hopefully will reduce the progression of this disease, relapse rates, and abnormalities on MRI scan. I think we should divide this up into two different categories. The first being the oral medications, the second being some of the intravenous medications or medications given through a vein. Right now there are active clinical trials on at least two oral drugs. The first is called FTY-720 or fingolimod. This is a medication that works in a very different way than the conventional medications. It modulates immune cells, especially cells called lymphocytes. It actually imprisons them in lymph nodes, and in doing so, these medications, these abnormal cells rather, do not get into the central nervous system. This medication can have side effects, such as macular edema. There's a higher incidence of some skin cancers. We don't know the full extent of this. The clinical trial has at least another year to go, and once that happens, we'll have a better idea of where we are with this particular drug. We're currently studying this medication in our office actively. A second oral medication is something called BG12. This is also being studied, and we're also studying this in our office. This medication works in a totally different way from FTY. It may have some protective effects. It prevents cells from trafficking into the nervous system. The side effect profile on this medication based on phase 2 trials is a little bit less, and the major side effect is basically abdominal pain and reddening of your skin. Again, these are now being looked at in phase 3 trials, and the full extent of how good they are and what their side effects are will be known in another few years. We think that at least one of these drugs may be out by 2010. If an oral drug is out, it'll hopefully reduce the MS population from having to stick themselves, which I don't think anybody likes doing. There are three more medications that I'll mention. One is called liquinomide. This has also been looked at in a clinical trial. The side effect profile on this is quite low. This is a later day linamode, which is a medication that's been out a while. This has been used in different types of cancers, and hopefully will be successful with multiple sclerosis. A third drug is something called teriflunomide. There is no active trial in the US now. This is now being looked at in Europe. We think that also this will be out within a number of years. And there's a fourth drug called oral cladribine. Cladribine was initially looked at intravenously a number of years ago. The trials showed that it reduced inflammation in the brain by dropping gadolinium-enhancing lesions. It was unclear what the effect on disability and relapses were. There is now an oral form for this medication, and a trial actually has been performed, but the results of this trial are not yet out. Those are the major oral medications that are being used, that are being looked at in clinical trials at this time. So by 2010 or 11, we may have 5 new medications out that hopefully will be efficacious in reducing relapses, progression, and MRI changes. There are also a number of drugs that are being looked at that are given through the vein. There's an active drug being used now called Tysabri, which most of you are probably aware of. Tysabri, when it first came out, was on the market for approximately 3 months, after which 2 people in the MS trials and 1 in the Crohn's trial developed a viral infection of the brain called PML. The medication was taken off the market for approximately a year and a half, and every single patient who was in the clinical trials was looked at in great detail, And it was found that it was only these 3 patients. The patients who did develop PML, 2 of them were on a combination of Avonex and Tysabri. 1 was on multiple medicines in the Crohn's trial. When they looked at the people who were given Tysabri alone, nobody had PML. The medication was re-released approximately a year and a half ago. Since then, there's been approximately 15,000 people who've been given active Tysabri, and when we add that to clinical trials, it's in the low 20s. To date, there have been no new cases of PML, but we all have to be extremely cautious. The medication is extremely efficacious based on the clinical trials. That's looking at both relapse rate, disability progression, and gadolinium-enhancing lesions. This is something that anybody who wants this medicine should speak seriously with their neurologist, because the side effects have to be weighed against the beneficial effects. In clinical trials right now, and one actually just finished, is a medicine called rituximab. Rituximab is a medication which targets a type of immune cell called B cell. Most people have not looked at B cells in great detail in the past in MS, but this is now being looked at very actively. Larger clinical trials certainly are going to be forthcoming. Rituxan or rituximab is currently being used now. It's being used for rheumatoid arthritis. It's being used for lupus. This medication can also have side effects, and in both the lupus trials and I think in one of the other trials, several people developed, again, PML. Again, these people were on multiple medications, so more studies clearly have to be done. Another medication that has been looked at and will be looked at again is something called Campath. Campath is also known as something known as alemtuzumab. This was looked at a number of years ago. It's given IV. The results from the initial clinical trials, and these were phase 2 trials, were excellent in terms of relapse rate and disability. The problem is that several people came down with a condition called ITP. ITP is where you develop a reduction in your platelet count due to an immune mechanism, and as a result of this there could be bleeding complications. A percentage of people also develop something called Graves' disease, which is hyperthyroidism. That is being looked at again, and hopefully now we will have better ways to survey who may be at risk for these conditions and nip any problems in the bud. Again, there is no active trial with Campath, but there will be. Another medicine that's being looked at is something called daclizumab. Daclizumab, again, targets T cells. It's given IV. The overall side effect profile has not been very, very high with this medication, and hopefully this will be efficacious. Another medication that we're going to be studying within the next 6 months is a medicine called ocrelizumab. This is a newer form of Rituxan and hopefully will not have the same side effects. Another MAB, and MAB means monoclonal antibody, that's being looked at is something called ofatumumab, and that is a daclizumab that will not have the same side effects, hopefully. There are other types of studies that are being done. One is T-cell vaccination. Another is giving people T-cell receptors. And a third type that has been done up in Canada is using DNA plasmids. And these are all different ways to desensitize people with MS to some of the antigens that may be triggering events. A clinical trial has just been finished on Fampride, which is a medication that hopefully will increase endurance, and hopefully that will be out fairly soon. Problems with endurance when walking is a major problem in MS, and hopefully this medication will meet that need. One of the problems with this medicine is that there is a slightly higher incidence of seizures, but that is something which is something that your doctor could monitor the reasons why this could potentially happen. So as you could see, there are many, many new things on the horizon. We're hoping, as time goes by, that with each of these new medications, we'll be one step closer to reducing progression, disability, and ultimately stopping this disease. Thank you.